Hi, everyone. Feel free to introduce yourself in the chat. Say where you're from, if you're a student, alumni, or a community member. We'll get started in just a minute or two. Hello, everyone. Feel free to introduce yourself in the chat, whether you're a student, alumni, faculty, or a community member. We'll get started in just a minute. Okay, welcome, everyone. My name is Alexis Grant. I'm one of the co-instructors for Epidemics of Injustice. And it's great to see you all tonight. I see we have people kind of from all over UIC as well as various places, looks like in Chicago. So it's great to see you all. And we're happy to have you here tonight. So today we have our 14th session of the course, where we'll be listening to a lecture by Ms. Washika Torres on fighting structural racism, the disability movement. So for folks who maybe have not attended previous sessions, last week we talked about, I'm sorry, the slide is incorrect. But last week we talked about environmental justice, and this week we are transitioning to a discussion on disability justice and the disability movement, which we will find, I'm sure from the lecture today, are interconnected with broader issues, racial justice and environmental justice. So we're really looking forward to that. And so a little bit about this course, if you are a visitor today, this is an annual course offered by the UIC School of Public Health that is free and open to the public. And the goal of the course is to prepare public health leaders and community members with the tools to bring about social change and address the structural determinants of health. So every week we have been meeting with a public portion from 5:30 to 7 p.m., which of course you are attending here today. And this course for the first year this year is being sponsored by the Collaboratory for Health Justice, which is in the UIC School of Public Health. And before we get started, I wanted to acknowledge that UIC is on the homelands of the Three Fires people, as well as a number of other indigenous tribes. And so we recognize those who have been robbed of their traditional homelands, and we are able to be here virtually today on those lands as an institution. And if you do enjoy this course or value this course or feel led to give our support for future sessions, the Collaboratory of Health Justice for Health Justice is hosting this course. And we hope to open more things like this in the future and support closed captioning, translation, ASL interpretation in order to make this course more accessible and more inclusive in the future, and hopefully having more events like this that are open to the public. So with that, I will go ahead and introduce our speaker for this week, more informally, because she is one of our co-instructors, Ms. Washika Torres, who is a doctoral candidate in the Disability and Human Development Department here at UIC. And with that, I will turn it over to you, Ms. Torres.
Thank you, Mrs. Grant. Hi, everybody. I'm really glad to be able to present kind of this area and how it's interconnected. And I'm glad that we've actually had conversations about disability in other realms such as arts, environmental justice, and environmental ableism. And I'm really hoping to be able to connect certain aspects of disability rights and wrongs, right? And racial inequities and how they're tied together, especially when we look at socially, but also how that configures into the health and wellness, not just health, but health and wellness of disabled people of color, and how that kind of manifests in our society. So I want to share my screen. There are no images in my PowerPoint. I did post this PowerPoint last night to the to Blackboard. There are no images, so there won't be any image descriptions, but there's also no sounds. I don't have to worry about that. Mhm. Is this going to work? There we go. So I have to minimize a lot of stuff because now I have all these things in front of me. So what I'll walk through this in the agenda again, but if people have questions, I'll just ask at the end of each slide. And if people want me to go back so that it's easier. Also, all my references will be at the end. And so some of them come from different places, and that's really important to acknowledge that not they don't just come from academic spaces, but they also come from activist spaces as well. So Disability, Race, and Inequity in Healthcare and Beyond by me, Washika T. Torres. Okay, why is this not working? There we go. So I like to start with an agenda usually. And so the first thing we'll do is introductions. If anything goes wrong, just interrupt me because I can't see the chat. We'll do introductions like, about myself. I'll tell you about projects that I've been working on or worked on in the past, continually working on, some disability terms or ideas that we're going to be kind of working with and through, how society sees disability, disability and health, right? Then disability and race, why those intersections matter for us, why health outcomes are so poor for disabled people. So we'll have a greater discussion about that. And then we'll have some discussion questions that will be like a kind of a back and forth for us, right? That I want Shawl to answer. And then we'll have some final words, a thank you, any lingering questions, because sometimes people do have questions and it takes them longer to kind of form them properly or they think about it later. And then, of course, the references I used, which as of last night, all of the links worked. So obviously, my name is Washika Tanika Torres. My mother thought it'd be funny if my name rhymed, so it does, Washika Tanika. I'm an Afro-Latina from the South Bronx, which is one of the poorest congressional districts in the United States, and has a lot of environmental issues because it has and probably will have a very industrial life cycle. As Mrs. Grant said, I am a PhD student at UIC in the Disability Studies program. My work mostly focuses on mapping disabled foodways, which I'll get into in a moment. I did film a documentary in 2017 on mapping disabled foodways in Mississippi, which involved speaking to disabled people, asking them, how do you get the food you get? How does that work for you? Is it effective? What are some other solutions? And really centering their narratives and their needs when it came to food acquisition, but also looking at the landscape of where I was in Jackson, Mississippi. I've been a disability rights activist since about 2008, so more than 10 years now, which has been a lot, good and bad. I do a lot of public speaking on different issues such as disability, building community, foodways, which, like I said, I'll get into in a second. I've written grants. I wrote a Ford grant with an organization that I'm a part of, CNLD, which is stands for the National Coalition for Latinxes with Disabilities. I was their treasurer for a time. And so much of the work I do currently looks at disabled foodways. So how do disabled people navigate the food system and what that means for them? So foodways is actually its own kind of field that came from anthropology and food studies. And it looks at how do different groups of people, generally race, class, a lot of focus on indigenous people, how do they navigate issues, opportunities, or barriers in the food system? And then how does that manifest? What does the food mean to them? For instance, what does soul food mean to Black people living in a particular area, right? What happens when they can't access soul food? What kind of substitutions do they make? And how do those substitutions have meaning? Even how you acquire the food you get. Do you go to a Black-owned grocery store, even if it's further away? Or do you go to perhaps a white-owned grocery store, even though it's closer and the ingredients may not be as authentic? Right. So that's kind of foodways, these kinds of negotiations, navigations, and the meanings behind them for different groups of people. Some people explore certain time periods. Some people do, like I said, race, gender, class. Very few people do disability. And you will kind of see why as I speak a little bit about social and medical models of disability. and how they play a role in the ways in which we see and don't see disabled people, and how that manifests um, in interactions, everyday interactions. So the projects, I did two. So I did one, like I said, about mapping disabled foodways, and then I did another one about pain. There have been a lot of issues when it comes to disregarding the pain, the different types of pain that women feel. So it was an exploration, kind of a conversational documentary about how pain is explored or ignored depending on, whether you're a woman, whether you're Black, whether you're a large, woman of size, and how those interactions happen between people, your family, your friends, and the medical, like the medical, industrial complex. Um, I'm also working on something called the Chicagoland Food Sovereignty Guide, and what that is a guide, right? And it breaks places down into neighborhoods, and disabled people, also non-disabled people, can go to different stores and different supermarkets and say, okay, this was accessible. My needs were met here, or well, I really wish that this store had wider aisles, or was more accommodating in these ways, and so that people who are disabled, especially those who are leaving institutions, can figure out, okay, well, if I'm going to live, say I want to live in Lincoln Park. Okay, well, I know these stores are not accessible. So living here means that I would need constant help, which I don't want, or someone would have to shop for me, which I don't want. Or say that I want to live in Ravenswood. Right now, I know this area in Ravenswood is more accessible because people who are disabled either have similar disabilities, or they're disabled have said, well, this is the write up of this store, and that will include looking at farmers markets, little bodegas, like little corner stores, supermarkets, different local chains, and things like that. Not restaurants, because that's more of a Yelp thing, but that's what the guide will do. That's the point of the guide, for disabled people to be able to say these are the things good and bad about these stores, and then you know activists can more effectively have conversations with these store owners, like, okay, well, these are the changes people want you to make. You don't have to make a million changes, but these changes, little by little, will make your store more accessible, and more disabled people can shop here. They want to shop here, but they can't because of these barriers. So let's do that. Like I said, I do public speaking about disability and food access, infrastructural access, like I just mentioned, gardening. I recently did, so we've had guests before that I've worked with talking about disability and gardening, how to make gardening more accessible, whether you're in an urban or suburban environment. Cooking, that's what my dissertation is on, cooking and meaning for disabled people. Shopping, public transportation, shopping in the store, any kind of assistance they do or don't get, and also how these things have been impacted by COVID-19, which is a lot. Just to shorten that part, paradoxically, more things have been put online, but that doesn't mean they're more accessible. Just because something's online, just because there's an app, just because someone says something is more accessible, doesn't necessarily mean it is, unless it has actually been vetted by disabled people who would need and use that. Um, and lastly, the program I'm working on now, which I've been working on since Christmas Eve, actually, it's called the Community Cuisine Program, and I actually cook for 4 families in Chicago, 4 families of 6 in Chicago, every week. A different meal every week. So I buy the ingredients in bulk, I cook them, I package them, and someone drives it to their houses. Many of the families are disabled, or have people who are disabled in their homes. So the entire program, from the idea of, okay, do you have food allergies or food things that you cannot have? That's something we've spoken to people about. Um, packaging, someone said I need to be able to open a package with one hand, so we went through different packaging options for everyone, and we tried them out, and we've gotten feedback from people about it. The food, we get feedback about the food, and everyone's been liking the food so far, so I'm very happy. It's also food I feed my family. Unlike other some programs where you get what you get, these are all recipes or things that I eat personally. And so yeah, and dessert too. Like, there's the idea of because you're disadvantaged, there are certain things you shouldn't have because they're wants rather than needs. Everybody gets dessert. So that's another kind of thing that's built into that program as well, that I do every week. So every Friday, I'm up at 9 cooking until about 4, and then I pack everything, and then by 4:30, it's all out the door. It's also easier for people who don't always operate stoves easily, because the food is still warm for them to be able to eat when it gets there. And a lot of them have children, and while you can get food from CPS during the week, the weekend is kind of where that gap is. So that's one of the many gaps that the program fills for people. Yeah. So were there any questions before I move on? Okay, so seeing none. Oh no, there was. Yes, pain is more often than ignored for people with disabilities. Yes, I would say that depending on other comorbidities, that is an issue about pain, and pain levels and pain tolerance. And then what does it mean for restaurants to be more of a Yelp thing? Oh, so Yelp has a guide where they do talk about access. Like, is this um place accessible, like wheelchair accessible? I don't know how much more they do besides asking about that one simple question, or what that means for some people, because sometimes they'll say, yeah, it is because we have a ramp, but the ramp is extremely steep or it's at a weird angle. And so someone with a wheelchair, whether it's manual or motorized, wouldn't actually be able to get in. So, but I don't do restaurant, like the guide doesn't look at restaurants. The food sovereignty guide, even if a store sells food, like hot food, that's fine. But it mostly looks at supermarkets, farmers markets, and things like that, like corner stores and things like that in people's neighborhoods. So that's kind of what I meant, that restaurants, they have, Yelp has an accessibility feature. Again, not sure how great it is, but they do have that feature. But there's not really a feature like that for supermarkets, because supermarkets can say, "Oh, we're accessible," and then you'll go there, and then there's like certain types of barriers or barricades or a little step, and that's not accessible. So there's kind of that. Um, so were there any other? Are there cooks and chefs in the community? Oh, other ones? No, it's me. It's just me. And I think part of it is, it's about a time thing. If other people had the time, perhaps. Um, but considering it, for right now, it's just me, but other people are involved. It's not just me involved in the entire program. I actually work with an organization. I will put their name in the chat. It's called Social Practice Labs, and we were actually able to get a grant from Whole Foods too to do this. And we partnered with a Trader Joe's in Hyde Park for a little while, and we were able to get like $50 in food, like once a month or something like that. Yeah, when you do the food in bulk, it's so much cheaper to get quality food. Like, and like tomorrow, for example, I'm making beef bulgogi, like ground beef bulgogi Korean fried rice. And so it's gonna have, but I have like really lean ground beef, so it's not gonna be super fatty. I have a bunch of vegetables, eggs and fresh rice and all these things, and it wasn't very expensive. But getting that, oh, so I did not do that. I would just look up social practice labs and see how they did that. I don't handle that end. I literally just handle, I well, not just handle, but the food I order, the food. Also, a lot of it's very nutritious. I love vegetables, so a lot of it does have like a lot of vegetables and stuff in it, or there's usually a salad with it. But what I'm in charge of is I plan the meal, and then I order the food, I cook it, package it, and then I bring it to the driver, who picks it up from my house. So that's how that works. The program is working. That's how it's been working right now. That's kind of how we have it streamlined. It was a lot more difficult when we first started around Christmas Eve. But thank you, Mrs. Grant. She just posted the Facebook page for Social Practice Lab, so you can definitely direct those kind of questions. But yeah, I figure out the food, I plan out month by month, and then I know, okay, this is what I have to buy when do I have to get it? I order it online. If there are substitutions that need to be made, I pick the best ones. And then I make the food. I take pictures. I do generally send pictures to Social Practice Labs of the food I've made and packaged. And I've been hearing nothing but good things from the family, so I'm really happy. And I just love doing it. It is definitely a big community thing. And although as a grad student, you have to make choices as to what you're going to do or not do, the community has always been my place. So doing this is if I didn't do this, I would be very, very, very sad. Even though I've dropped a lot of other things, this was very important to me. So, okay, moving on from the projects. Why won't this click? Why is this? Oh, here we go. So here's some disability terms I kind of want us to think about, or to yes, to think about as we think about health, public health, other types of health and wellness. So in disability, or in the field of disability studies, or disability as a field, there's a difference between disability and impairment. So impairment, and this is actually from Leeds, and they have an from the UK, one of the kind of founding institutions that had a disability studies program. So impairment is an injury, illness, or congenital condition that causes or is likely to cause a loss or difference of physiological or psychological function. So, meaning obviously that there's going to be maybe a loss or a difference. So maybe you don't lose something psychologically, but psychologically your mind works different, right? Or physiologically you can do a task with your body, but you just do it differently from other people. But disability is the loss or limitation of opportunities to take part in society on an equal level with others due to social and environmental barriers. And so, what does that mean? So, that means that, so if someone uses a wheelchair, right, because wheelchair bound is not an appropriate term, but if someone is a wheelchair user, then they don't have a loss of quality of life, and we'll get into that soon. But their opportunities are more limited. It is the environment and society that is disabling them because, oh, this building has stairs, there's no elevator here, or the elevator leads to stairs, which happens way more than you would think. Or this ramp is too steep, or it's just plywood. There's some drawings of people where they just put like plywood over something, and that's supposed to be an accessible thing. Or they said something was accessible, but when you get there, it's actually not, because no one actually checked. They just took whoever's word that it was accessible. And so, and that means an loss of opportunities, and that doesn't just mean work opportunities, because that's obvious, but like for instance, voting. They say every polling place is accessible in Chicago, right? That has been proven to be untrue at times. So, Equip for Equality is one of the groups that does go around to every polling site to see if it's truly accessible or not. Some schools, because of COVID, had alternative entrances that may not be accessible to everyone, or there's a ramp, but it leads to a set of stairs, right? And that means that it's not accessible. Or they had voting equipment. I voted as a I worked as a voting judge once, or an election judge, and there's a machine that you're supposed to set up for people who need, they just can't push buttons, or if they can't fill things in with a pen. And some places didn't set it up at all. It's in the manual. There are people who can, but they didn't. So now if someone needs that, that electronic voting thing, or however the machine worked for them, because there were different things you could plug in, now they can't vote, right? There's not an opportunity for them to vote, or they have to fill out an absentee or some other kind of ballot, provisional ballot, but that's not the same opportunity. um, the medical, so then there's also two kind of models that we work with and through. There are other models, but these are kind of the big two. There's kind of the medical, the disability impairment are the same thing, but the idea that disability and impairment is within the individual, right? And the person must be fixed or cured or healed or something to be made whole again, quote unquote whole again. And then we have the social model, and that disability is located in the way society is organized, right? It is a restriction of activity, and it's caused by what they call inadequate social organization, meaning that the way we look at society, there is this hierarchy, and we have the needs of certain people in mind, and other people we don't think of at all. But this is what I do want to point out. The social model does not reject medicine. It does not tell people don't go to the doctor at all. That is not what the social model is about. It's not what the social model is for. But it acknowledges that people with disabilities, it's not their own failures that there are barriers. The problem isn't that you use a wheelchair. The problem is that there are no elevators. There are all these stairs. There was actually a disability exhibit that was a gallery showing um, from a disabled artist. He couldn't get into the art gallery. Like, his work was in the gallery. They brought his work into the gallery. He couldn't get into the gallery to see his own work because there were only stairs. And he assumed, they said, oh, it's accessible. He assumed that they were right until he got to the space and he couldn't even get in for his own show. right? So that's not a personal failing of him, but again, the way society is organized, the society's treatment of disabled people. This includes environmental, societal, and other barriers, which we'll get into more in a moment. So, how society sees disability. So, I have two slides for this. So, this is late 19th century through early 20th century. Um, and in some places, this is still true, but in many places, especially in the US, it is very much not. Um, so, disabled people, they were a sign of degeneration, illness, contagion, bad genes, right? They're not, people weren't fully sure how genes worked, but that's what their thought was. Disabled people should be pitied and withheld from public view, put away for their own good and the good of society, meaning that they had to go to state schools. I do believe I mentioned Willowbrook State School, which is on now the grounds of the College of Staten Island. But state schools, they felt, well, the government and the state can take care of your child better than you. So they would take people's children. This happened to many children, especially in New York. If your English was not your primary language, there were a lot of children who were taken away from their parents because they were like, oh, you cannot provide care for this disabled child. And then the parents didn't fully know what was going on. Um, the idea that disability should be eliminated through cure, rehabilitation, institutionalization, public policy, or death, and that eugenics encouraged not only the production or reproduction of those with desirable traits, but discourages reproduction of those with undesirable traits through sterilization, death, segregation, marginalization, things like that. And I do want to say, unfortunately, right, even though we're in the 21st century, there are ways that this still happens, right, where there are disabled people whose children are taken away from them, right, even though they are fully equipped to take care of their children. There is a high likelihood of that happening. That happens also with indigenous people who are disabled, people of color who are disabled. That happens a lot as well. And so there's something in the chat. One second. Okay.
Zoe asked, would you be willing to say more about how pain is thought about in terms of disability and impairment?
Mhm. So, well, there are people who have chronic pain issues. And so if someone is, for instance, say someone is like me, but I'm a large person, I'm a person of size, right? If I have chronic pain issues, right? And I say I have, I can just give you a real life example. I'm diabetic, but I also have chronic pain issues. Like I have inflammation in my knees. I had an accident that I never went to physical therapy for. So my knees, they healed wrong. Once I moved here, I also started getting more pain in my joints from the cold because my body is just like, this is not some kind of cold I'm used to. So now I have inflammation in my knees and through my legs. This precedes my diabetes by 2 years. My doctors were aware of this and didn't get the treatment that I really needed. But now that I'm diabetic, right, newly diagnosed for like a month, I told my doctor, oh, I'm walking more, I'm doing more activity, getting healthier. But I am, my chronic pain issues, they're flaring up again. And I thought it'd be better because it's spring, it's not as cold. And my doctor said, oh, well, I think your inflammation and your chronic pain is just due to your diabetes. And I told her, you've been my doctor for since 2019. I had this issue in 2019. I didn't have diabetes in 2019. These issues precede my diabetes, but because of how I am seen as like they see, oh, the diabetes, oh, this is just, some people see this disability, some don't. Now, if I was thinner and or didn't have diabetes and I had chronic pain issues, they may be taken differently, more seriously. But that is kind of the issue of the way people see pain through the lens of disability. They may there's also the idea of whose pain is treated as real pain. There are a lot of women of size who have complained that all the pain they feel every time their doctor says it's because of their size, but people who aren't women of size get treated more. But then also the idea of women in pain, and is this hysteria or is this actual pain? There's quite a bit of literature on that as well, that you can also explore about chronic pain and whose pain is believed and whose pain is not believed. So those kinds of issues do pop up, both in and outside of medicine. When my knees hurt or I'm walking with somebody else and they tell me to walk up, I can't walk faster. My knees are killing me. So that's also something to kind of think about as well when we're talking about like pain and the manifestation of pain through disability. All right. Next slide. So this is kind of continuing right now. So some people say see disability in metaphor, right? We understand something is bad because we understand disability is bad. So sometimes characters are seen as disabled, whether mentally or physically. The idea of a quote unquote kind of grotesque monster kind of goes to the idea of disability, um, or people who are disabled have really bad attitudes because they're disabled. That has happened a number of times. And you'll see that in film and media and in different types of conversations. Or the fact that, oh my God, you lost a limb. This is the worst thing that could happen to you. No, there's probably worse things that could happen besides losing a limb, right? But the fear of disablement is a fear because people think of disability in this negative way. Disability is a problem that has to be solved, right? Oh, this happens and you need to be fixed in this kind of way. And oh, once we fix this problem, we'll fix you. And it's like, that's not how that works. Disabled people as perpetual children. This is particularly blatant when you see children or people with intellectual disabilities, which is not the case at all, right? They're not perpetual children. People are adults. Um, People with disabilities as either asexual or dangerously sexual. Disabled people have sex a lot and children and sexual desires. And there are some who might be asexual, but that's not because they're disabled, right? Those aren't the same thing. But people and also that happens in film and media equate these two together. And so these ideas, you don't only see them in media, you see them perpetuated in institutions of learning as well. When people are talking about disability and that fear of disablement through different things, or say, oh well, you're going to if you don't do this, then you'll become disabled, and then your life will be over, right? That it's kind of like you're already dead before you're in the ground. Um, sorry. In films and television and things like that. And then those seep out outside of them because media is just a reflection of how society feels or thinks about certain things. It's not a totally separate realm. There are two things in the chat. Yes, yes, awesome. There's a recording from about fat phobia in medical settings. Yeah, and I've definitely had issues with that. Right, I've been fat since I was 8, so I've definitely had these issues for a long time. So next, why is this not moving? What is this? There we go. So disability and health barriers. So to get a bit more specific, and again, I do have um, what do they call references for these. So people with disabilities experience higher barriers to primary care than those without disabilities. And there are many reasons. Financial. If you look at the disability employment rate, it is abysmal, right? If you look at the employment rate, the rate for people with disabilities who are unemployed is also extremely high. And sometimes that is due to, there's also underemployment, right? Which is also something that's not spoken about either. So there's unemployment, people who can't find work. There are people who've given up, which they're not necessarily included in the numbers. There are people who, sorry, extremely thirsty, who have additional costs that they have to bear. So finding primary care is harder. Doctors that are are going to take their insurance that they do have. I know we mentioned county care. Finding a doctor that takes campus care that's not located at Maxwell has been really difficult. My doctor tried to write a referral for me. They were like, no, we're not giving her that. This referral is not going to work. So for other doctors, I've had to pay out of pocket, and that can cost hundreds of dollars per visit. Social, when you are interacting, or when you even before you even get to primary care, there are a lot of people you have to interact with first. I can't just call my doctor and set an appointment up, right? I have to call a number or call this number to call that number, and then oh maybe I have to call paratransit, and if somebody along these routes is having a bad day, or somebody is not cooperative, right? And I have certain needs, right? Say like I have a speech difference and I speak a little bit slower than some people, then I might get hung up on. I've gotten hung up on and I don't have a speech difference, right? And then you have to call back and call back and call back because they're seeing you as more of a nuisance as a new client than anything else. Setting up different types of transportation, infrastructural and structural, pace. Paratransit is notoriously unreliable. Also, Uber, if you want to take Uber, what is the Uber Wave program, you have to wait longer, sometimes 20, 30 minutes longer. And then those rides can cancel on you, right? And then you'll have to wait maybe another 20, 30 minutes. You get to your doctor's appointment late. They don't want to hear why you were late. You just might not be seen and you have to try again another day. Um, but one of the biggest things is not as well researched are attitudinal barriers, like the way doctors see disabled people or the way they interact with disabled people is not as well researched. So a lot of disabled people will talk about this with one another, right? In groups or in like Facebook groups or when we're with one another or maybe in disability studies classes. I know that there is a student, MD student in the School of Medicine, Zoe Sheets, who is also in public health, who actually did a presentation about this. And I was on the panel with a number of other people speaking about these different barriers, about doctors, and their attitudes towards dealing with a patient. I went to the doctor for something and this conversation is not going the way I want to. I'm trying to assert myself, they're ignoring me, or if I don't agree with them, they're saying I'm non-compliant and I'm a difficult patient, where if they had just listened to what I was saying, we would have gotten to the root of my issues. um yeah, let me see, I'm trying to see if there was a question. No. Oh wait, no. There was a question. I'm trying to read. Zoe, would you like to read the question so I can understand it better? Sorry.
Yeah, I can just summarize. We could also talk about this later because I feel like this question is from a past slide. So if you want to wait, I'm happy to do that too.
Oh, I can, yes, and then I can just go back to any slide if you would like to do that as well.
Yeah, because I don't want to just like interrupt your flow. So we could do it later
and thank
too.
you also for the misconception about people with disabilities. Yeah, that's a huge thing too. These misconceptions and leads to misinterpretations. But let me just let's go here. So people with disabilities that report that their health is fair or poor more often than those without disabilities. And so that's a ratio of 40.3% to 9.9% of people. People with disabilities report higher rates of stress and depression than people without disabilities. This is not here, but they also experience higher rates of food insecurity. Even if one member of your family is disabled, you will experience higher rates of food insecurity. And I know that that was in some of the supplemental reading. And there's also the reading about, yeah, so like mental health is also tied to food insecurity. So it definitely will disproportionately affect disabled people as well, because they're also more likely to be food insecure. But also disabled, so from in 2015, disability associated healthcare expenditures accounted for 36% of all healthcare expenditures for adults residing in the United States, totaling $868 billion. And some people will look at this number and they say, well, that's really high. How do we get it down? And I think for me, one, healthcare is one of those things that's a right. But I also think that some people's solutions have been to privatize health. But for disabled people, that has actually led to more problems, because what a lot of privatized health people sometimes will do is they will set up higher barriers to prove that someone is disabled, or they will cut the hours of care that some people have, or again, institutionalizing people. That's another thing too that people think would be better, right? Because they're all grouped together. But I think as we've seen in the pandemic, for many reasons, institutionalization is dangerous, not necessarily healthy, and it's not what disabled people want. That's the biggest thing. Throughout all of this, always remember that when we are talking about the needs of a community, we should always be centering that community, right? So when we're talking about disabled people, we should be centering the needs of disabled people. We should be speaking to disabled people, working with disabled people, working for them. Um, So sorry, it's just the things. So I just want to remember that, because that is the way you get better care for that person. That person is willing to come back to see a doctor more. They're willing to, kind of educate rather than have an adversarial conversation with a healthcare person. And it leads to a better, healthier relationship overall and healthier well being when people feel like they're heard, understood, and their opinions and ideas and thoughts are valued. How do you effectively measure opinions, such a broad community? That is a really good question. I think one of the biggest things that I've done, right, is speaking to advocacy groups, like who that are comprised of people who are disabled, right? Because, and I heard this quote, and I thought this was a really great quote. Not every disabled person can speak for the disability community, but non-disabled people cannot speak for the disabled community. But they can't speak for anyone in the disabled community, right? And what that saying means is that disabled people, right? Yes, it's broad, just like African Americans. We're not a monolith, right? But we do have needs like justice and equity and things like that. How to approach it is different. It's not an easy task. But when you bundle a group of people together and say all their needs are the same, as opposed to kind of looking at their needs differently, and we'll kind of get into that in a moment, then you are doing a disservice to the community because you may be serving this monolithic idea of what you think a disabled person is. And that's what some people in health do, and that's what some people in the disability movement do, and that has not been working. And so each field has really, they're really coming to the fore with like the recognition that there needs to be something better done, that we all need to do better, and we can do better by working with groups that already exist. You don't have to reinvent the wheel. There are plenty of disability advocacy groups comprised of, disabled people, right? Centers for independent living are generally comprised of disabled people. So you have the Progress Center for Independent Living in Chicago, you have Access Living in Chicago. There's different disability dance groups, like when Maggie and Sydney were speaking, and also I was supposed to call her by her first name, for the art for advocacy, different art groups. There's so many different groups that are already established, not just in Chicago, but digitally. When I was living in a place where there weren't a lot of disability groups in town, digitally it just was exploding, So that's something great too to speak about and to ask people about. When I had to do a survey, I was in my house. There was no way I could go out and ask people. So I did it online, and I got, a wave of responses about disability and food during COVID-19. So that's something really good that you can think about too. So let's kind of go into, disability and race. So this is kind of how we get into the more nuanced conversation. So people of color and people with disabilities face barriers to education and employment that limit their earning potential, right? So these are things that can happen separately. I have two hands up in circles, right? So can be two separate things, but they often overlap too. So if you're thinking about people of color having barriers to education and employment, and disabled people having education and employment barriers, right, that limit their earning potential, imagine what is happening. This is now me pretending this is a Venn diagram in my hands. Think about what a person of color who is disabled is facing, right? I have a friend who has a lot of degrees, had a career, but the career she wants to go to, she's like, people just see the disability. As soon as I walk in, that's what they see. And that's it. That's the end of the conversation, right? And then, being a Black woman, and I'm getting older, all of these things are happening at the same time. But when they first see me, that's all they're seeing. And so African Americans are not only more likely to have a disability, 1 in 4, 25%, but it appears that the impact of disability on their lives is greater than that of their white counterparts. And that's because of those other factors: education, employment, other forms of discrimination that play into this. This also manifests in the school to prison pipeline. I know some of you have heard about that, but for those of you who have not, this is where, disciplinary actions that happen in school for children, especially for children of color, they are escalated more often and at higher levels than, people who are not children of color. So say, for instance, you're getting into a fight at school, and for, maybe it's detention if you're white, but if you're a person of color, it's a suspension. It's a write-up. It's the police coming to you and putting handcuffs on you or pepper spraying you or something. Having police in schools can often exacerbate that. And there are issues where there's, violent use of force against children. But for instance, in the Pittsburgh public school 45% of Black boys and 26% of Black girls in the Pittsburgh Public School police, they refer them to juvenile justice facilities, and this percentage of them have disabilities. So a large percentage of Black disabled boys and girls, they have disabilities, and instead of getting treatment or services that will help, with whatever is manifesting in terms of their disability, they're just being written up. They're just being disciplined. So if someone is neurodivergent, instead of getting the testing and the accommodations and the help that they need, which they are legally supposed to be getting under like IDEA and, free and appropriate education for all children, they'll get punished, they'll get isolated, they'll get written up, they'll get put in rooms. The police will be called, not a safety officer, not a peace officer. The police will be called, and that will eventually lead them going into juvenile justice facilities where they are also not getting the care they need. Just like in prison, a lot of people in prison have disabilities and they are not getting treated properly. They weren't getting treated properly outside of prison, and they're now not receiving the full treatment they need in the prison system. So that's not solving the issue either. So no kind of institution, whether we're talking about long-term institution kind of care facilities or these kind of juvenile justice or prison facilities, are giving disabled people, especially disabled people of color, the care they actually need to manage and navigate the system that they're in as a disabled person of color. So let's continue with disability of race. Having a disability creates extra costs for people and can limit their economic opportunities. So if you think that a disabled person, all the things they need, they can get through, like insurance, that is not the case. There are certain basic things people can get, but other things, that's not all inclusive, right? There are some things you need, or things that are better equipped to help you navigate, being disabled in the world, that you're not eligible for. So there are a lot of companies, tech companies. I don't know if anybody's ever been to an expo, any kind of expo, but there's one in Schaumburg every year. That's a really big one. And you will just see the latest and greatest in disability tech. They will have special utensils, new kinds of wheelchairs, both manual and motorized, things to help get you out of bed, to move stuff. If your hands tremble, for instance, there are special like plates and utensils and stuff that help with that. Cars and trucks and scooters and canes. There's a cane with GPS in it. There's like a different glasses, all these different technologies, right? Amazing. Insurance is covering almost none of those things. Sometimes you can, and if you have private insurance, which some people don't because you might have to get that through your job, you can't afford those things. That would make it easier to navigate economic barriers. I've had plenty of friends who've had to pay out of pocket a lot of money for the things they've needed. There are some programs where you can rent things, especially assistive technology, where you can rent them, but those databases can be really limiting. Some things are old or out of sync. You can't use them anymore. And so the cost of that, of even getting something that will help you, be gainfully employed or help you even navigate a city better, are just, it's one of those economic barriers. And they keep making new stuff every year. Every year there's new stuff coming out with the expo. But the policies that are going to enable people to get those things haven't changed. So if you already are a person of color with poorer outcomes, right, in terms of income, how are you going to get that, right? If you already are somebody who does not have the same earning potential because of educational barriers, right, you weren't able to get a certain type of degree that would have paid you the adequate amount of money to get you those things, then how are you going to do that, right? So for example, one great example, disability benefits, including healthcare coverage, they hinge on you proving you can't work. But if you need, like anti-poverty programs, so like SNAP, for instance, if you're on SNAP, there's a work requirement. So there's this like paradox you have to live in. And some people do get like you can be disabled and get like SNAP and stuff like that. So I'm not saying you can't, but also the amount you get is abysmal because they're counting other things you need to live in as income. So at one point, SSDI got raised and then SNAP got lowered for some people. So like, oh, this is extra income. even though it's going along with the rate of inflation, they're not doing that when it comes to SNAP. And speaking about disability studies, like I said, the field is not perfect. Melissa Thompson had this hashtag disability so white, to shed light on the ways Black, Indigenous, people of color, sometimes called BIPOC, are consistently marginalized and often silenced in disability justice spaces. So disability studies, I mean, you can see disability studies and justice is the same thing. It's not really. Disability studies is more the academic wing of disability. There's like disability rights and justice, and then you have disability studies, and they work together, but think of them as wings of a hospital. And the issue has been that a lot of times when speaking about issues about race, or the people of color having a race or ethnicity, those are often silenced or kind of excused away, right? So some people will say, well, let's just look at disability, right? Let's look at what brings us together, not what pushes us apart, right? And that's not going to work because there are many disabled people who are not just disabled, right? As a Black woman, I don't just live the existence of a Black person, I live the existence of a woman as well. And those experiences are often not, you can't really separate them. There are some instances, yes, where there's experiences where I'm experiencing this kind of racial bias, right? Or racial segregation or, racial discrimination. And there are times when I'm experiencing sexism for sure. But often, more often than not, I'm experiencing those things at the same time where the racism is sexualized and the sexism is racialized. So a lot of disabled people of color are like, no, my experience as a disabled person of color is not going to be the same experience as a person who's not a disabled person of color. Just like if you're disabled and you are a person of color, your experience as an able-bodied or non-disabled person of color is going to be different. And so this hashtag came about to recognize the ways in which disabled people, when they speak about their experiences as a disabled person of color or a disabled Black person or something, they are silenced like this is not, important or relevant or damaging to the movement because it's creating division, right? And some people think it creates division rather than creating nuance and depth, right? So that's another thing when we think about disability and race, and think about that in healthcare, right? You cannot, the same things that may work for a white disabled community are not going to work for a Black disabled community or an Indigenous disabled community or something like that. So that's something you also have to think about. So why these intersections matter? So it's because race and disability are not completely separate sources of disadvantage, right? That parallel each other. They're not like this, right? They're not the same, right? They're not the same exact thing. There is a professor, a white professor, who, so there's a term for non-disabled actors playing disabled people. And he equated the practice of this to blackface. No, it's not the same. It is a group of people being something they're not on camera, but it's not the same thing, right? And if you're horrified, I was too. But race and disability are overlapping in how they're both treated, right? People who are people of color are not given the same advantages. And some people say, oh, well, there's programs that address that have been woefully inadequate. As we can see, racial disparities in healthcare and health treatment and opportunities and things like that. So both groups of people have been systematically marginalized through many different lenses of education, income, where they can live, what they can do job-wise. And so often people say that disability is both a cause and consequence of poverty, and poverty and disability reinforce each other, contributing to increased vulnerability and exclusion. And so what that means is a lot of disabled people are poor, right? And that's what it means is it's the cause of poverty, right? And also the consequence of poverty. Once you become disabled, there are a lot of people who do lose, they don't have their jobs, or the workman's comp they get is not compensatory with what they need. Or, once you are, when you are disabled, because there, like I said, lesser opportunities that may happen, that you will wind up poorer than if you were not disabled. and that poverty and disability reinforce each other um, through that kind of cycle, and you're increasingly vulnerable and excluded. So you're increasingly more and more marginalized. And then if you include race in that, there, like we said again, you're increasingly more and more marginalized. And then poverty causes disability. So if we're talking about people who cannot afford to live in a good place, when we talked about environmental ableism, the propensity of disabled people who are poor, they live in these areas that are not good for their health. They're detrimental, right? Because they can't afford to live somewhere else because somewhere else may not be accessible, or if it is extremely exclusionarily expensive for them, right? Not every disabled person, obviously. I don't want you to think that. Not every, but a good amount, an amount that is enough that it's a problem. um, and you have poor people tend to work more labor intensive jobs, and ones that are, sometimes even unsafe. And I don't just mean like construction work, but there's a lot of very manual heavy jobs that are not safe for a lot of people. But because they may not have the luxury of choice, they may have to choose these more dangerous jobs. Um, People in poverty are less able to treat disabling conditions and to mitigate their impact. So preventative care for some people is almost non-existent. They can't afford to, oh, let me eat these things that are better for me now so I don't have to go to the doctor later, or oh, let me get this, special whatever I need now to help me later. They can't plan, they in their minds, yes, but financially it's hard to plan that way when you barely have enough for like the next week or the week after that, after paying for things that you need. But then when you do become disabled, right, it's hard to treat that. Just like we said about financial barriers to care. Yeah, warehouse jobs, definitely. Warehouse jobs. I've seen so many videos, and also when we were talking, what the impact of COVID on the meat industry. The meat industry was already facing a lot of issues with their the way they're trying to like create kind of robots or mechanized people or like human beings and things like that. So and then you have people who've gotten sick from those kinds of jobs, and then COVID just made it, exacerbated that. COVID really exacerbated the dangerousness of these jobs, the propensity of poverty and disability, and how those issues and areas intersect. And then we said disability causes poverty. You get hurt or something and it happens, and then jobs have found so many ways to fire people, and you may sue and you may win in 10, 15 years, but you have to eat and live those 10, 15 years. Your family does too. But also race is linked to poverty and disability in America. So like we said, African Americans are more likely to be disabled, right? And part of that is they're more likely to have those lower paying jobs. They're more likely to be poor, not just because they're in lower paying jobs. I want you to remember that. It's not just because they're in a lower paying job, but because they're also getting paid on the lower end of those lower paying jobs. So say someone is making 20, a person of color, that's not black, may be making 17, and a black person may be making 15 or 12 or something like that. So it's not just, just, oh, you're working a lower paying job. You're also getting less pay within that range as well. There's also that income gap for workers as well. So I said the space was left intentionally blank because this is the part where we kind of all come in and begin to speak on these issues together. So, as I've said, right? So, why are health outcomes so poor for disabled people of color? And I want you guys to kind of put this in your own words, or um, look at this from your the perspective of where you work or stories or where you've lived, or if you're disabled yourself and you want to say something, that's you can also say that as well. um but yeah, oop, no, not yet. But yeah, I'm opening it to everyone. Let me mute myself if I can. I can. There we go. Sorry. So Amy said that people of color are less likely to have adequate access to healthcare. Yes. And that's been an issue in Chicago. A lot of hospitals have either been closing or moving or not providing adequate care, or things are privatizing. And sometimes that can be a big issue for people, or the healthcare facility is not equipped to handle the issues that are happening in the community. So you may have a small clinic, but you definitely need a hospital to take care of the needs of the people in the area. And you're the only place that gives care for maybe more than a mile. Um, so if someone needs chronic care, where are they going to go? So their fatalities may go up. Um, Disabled people of color, um, sorry, I'm trying to read these, might not have access to transportation due to living in neighborhoods that are underfunded, lack of transportation, no way to get to healthcare facility. Yes, yes, where I live, to get to pretty much anything adequate, it's either a long walk or two buses or a bus and a train. Many victims of violent crimes are people of color, and often survivors will face disabilities. Society may view this disability as self-imposed. Yes, there are some disabling conditions. I don't, not just disabilities, right? Some disabling conditions that people see as, this is your own fault. You did this to yourself. Um, no, a lot of non-permitted people will park in small amounts of permitted spots. Yeah, even if it's close to a non-permanent spot. Um, and police will ignore the violations. They won't even ticket or tow. So, do you think socially? Okay, I think you can confront them, but also make sure that, because some people have confronted people who are actually disabled or with someone who's disabled. So that might be something to think about. So you can always ask them, and if they're like, "Oh, whatever," and blowing you off, go for it. But I do think I think the other thing is to bring light to this. Like, let people know that this is not okay, because why are you using that spot? Are you using that spot because you don't think a disabled person's going to use that spot? Like, the spot's there for a reason. Do you think the disabled person needs to, like, just walk further? Like, what is your mindset? Why would you do that, right? And this, again, it goes about how we view disability. If someone is blatantly ignoring that this spot, or parking on the lines is not good, because people have vans and they need to be able to get in and out. And if you park on the lines, they won't be able to. So I think that would be effective too, like reminding people this spot is here because disabled people exist. Disabled people use this space. They want to go here, they need to go here. Doesn't matter if it's a pharmacy or if it's a restaurant. The spaces are there for a reason. Um, yeah, medical epistemology does not always take disabled people's complaints seriously. So my personal experience, plus, I mean, honestly, you can ask a lot of disabled people if they wish to share, right, their stories, and they will tell you that, nope, my doctor said I need to do this. Dr. Sandel mentioned the doctor saying she'll need to get surgery or she'll be in a wheelchair. She got the surgery, she's still in a wheelchair, but being in a wheelchair has actually been better for her, right? It's been freeing for her. That's why the term wheelchair bound is not appropriate. It's not I'm not bound to this. I'm not tied to this in a negative way. It allows me to go places I may not have been able to go otherwise. SSDI is hard to get and renew, and there's this point system. That just blows my mind. My friend who is on SSDI, she knows how the system works, obviously, because she's had to navigate it for so long, right? Because she was born disabled and she was able to get a job, but now that she doesn't have that job, it has been difficult. And having the paperwork and going to the doctor every so often. Stigma, thinking that people are lazy, is a stereotype too. Yes, this is a stereotype attributed to low income people, to Black people, to disabled people. Oh, the only disability is a bad attitude. What? No, I'm disabled. That's not how that works, right? So yes, to healthcare is also worse for people with limited English proficiency. So, like I mentioned before with Willowbrook, one person who had spoken about what happened was his mother was primarily Spanish speaking, and they were saying she is not equipped to navigate the K through 12 system with her child, because her child was disabled, and that's one of the reasons they took her child away. Yep, people of color's issues, medical issues or otherwise, are not taken seriously. Um, does larger stigma around disability discourage disabled people and chronically ill people from seeking both medical care and community support? Medical care sometimes, because again, it can be really expensive. Say you want a second opinion, good luck. Like I said, I tried to get a referral written, to get a second opinion on something, or to get a different care plan. It didn't work, right? So sometimes you may not be able to see someone else, or the people you're seeing, they may have a particular type of mindset when it comes to medicine, or when it comes to what does healing look like, what does health and wellness look like. um, and for a lot of disabled people, community support has been what's best. There's a lot of groups that are, like I said, a lot of groups have popped up for a reason. Like, they exist for a reason, to help disabled people in different types of situations navigate the system, or just be able to speak to one another. Crystal said, I know that there's a lot of disability justice narratives around ADHD, and if someone's been recently diagnosed, stigma, both mental and health and physical, and sorry, mental health and disability is huge, and trying to navigate the healthcare field with all those referrals. Yes, yes, I got a referral to a private place once, and I was like, I can't afford this. What are you doing? Yes, disabled veterans. Also, I actually did a paper on the VA, and the VA's budget, right before the Walter Reed scandal, if anyone remembers that, was actually cut twice. And even though it was cut twice, there were huge increases in recruitment and deployment of soldiers overseas. So you had a whole lot of soldiers, and a lot more soldiers are surviving because of advances in technology. So now a lot more soldiers are becoming veterans, right? But the facilities are not, they're not always kept up, and people who were really good, they would leave. So a lot of this with the whole Walter Reed thing was like, oh, we need resources, resources, resources. But the issue has been, they've been getting their budget cut, even though there were increases in deployments and more veterans coming out of the system. Yeah, so and that can happen too. So navigating referrals, yep, it's difficult, and it's um having to jump through hoops to make sure your insurance covers things, and they may have covered things one month and not another. I've had, people have had their medication switched because, oh, insurance no longer covers this, and then it's like, well, this one doesn't work, and now you have to go back to square one with experimenting with things. Someone's level of education is a factor. Yeah. Let's see. Yeah, misunderstanding of their diagnosis. Yeah, there's a whole lot of things about health and wellness that I've learned more from community members who have similar issues to me than from like my doctors or something like that. And if you are not cooperative in the ways in which they want you to be, that can also be a problem, especially if you're a person of color. Um, so that. So here is another, and then I have a set of discussion questions. Here we go. Is this going to work for me? How do we see or measure quality of life? And you can put that in chat, or you can, no. Or you can kind of just say this. I'm gonna open the chat. So yeah, how do we see or measure quality of life? Now there are charts and there are graphs and there are questions, but how do we see it? When we see someone who has a good quality of life, what do we think about? Yeah, people's needs being met. Yeah, that's really good. Yeah, whatever those needs may be. Yeah, through the lens of the person themselves as it intersects with our own. I think that is a really great point. We can see, and DAL wise, exclude years with disability. But yeah, we can also see, there's these different metrics and these different ways of doing that. But what I kind of want to get to that point of how it intersects with our own. I want you to think about these metrics that you're thinking about or talking about and thinking about. I don't know, I said thinking about twice, or that you're typing up or that you use, and think about how many of those maybe from an able-bodied person's perspective, right? From the idea of able-bodiedness as quality of life. I want you to think about the ways in which we see quality of life in and out of healthcare as from an able-bodied perspective. And what that means, what does that mean for someone who is disabled, right? Or who has some kind of loss or difference, right? Or someone who has mental health issues or challenges, or maybe they take medication, maybe they don't. if we are looking at these metrics, and these metrics are created through particular lenses, what do they automatically? Yes, we use neurotypical able-bodied people as the reference point. And if we continue to do that, right, then we are automatically going to, not everyone, obviously, right, but we as a society will automatically then see a disabled person as automatically not having a good quality of life. And that's the frame of reference we'll start from. Or when a disabled person doesn't have a good quality of life, we assume it is actually their impairment, right? And we assume their impairment and their disability are the same, which we've already established or not. But we will assume it is solely because of their impairment. Let me make that clear. Solely because of their impairment, that this is the problem, and not because of how they're being treated, not because of all the other things. Like when we look at someone, for instance, who gets sick a lot, like my mother gets cold all the time. And people say, oh, you're just not taking care of yourself. Oh, it's the food you're eating. Oh, you need more exercise. Maybe it's because you live behind a train yard. Maybe it's because you live like you live in the back of a building where they're dumping garbage. That's where the garbage is collected. Maybe it's because of where you live. They used to burn garbage and they still burn garbage illegally. Maybe that's why you're getting sick all the time. Maybe because, your kids have chronic issues too. And maybe because your kids are born with chronic issues too because of where you live. And your family has a history of that. And they all live there. And all the other families who live there have those similar issues. Even if their diets are different, even if they're different in terms of racial or gender makeup and age. So, again, we think again quality of life, and we're thinking about certain frames. And when we look at certain frames of reference, or only one frame of reference, we miss the nuance and the depth that gives us better tools, right? That equips us with better tools to serve the community, right? Always remember that when we do community work, we are serving the community, right? And it may in many ways be fulfilling needs we have, but again, serving the community. I think that's really important to think about when we're thinking about how we see or measure quality of life. So next kind of discussion question is, in what subtle ways do we see discrimination happening in our fields? And so I did mention Disability So White, where there was this huge controversy about a paper that was written, and it was not peer reviewed, written by two, I believe, white disabled men, was not peer reviewed, but was put into a major journal. Right. And it's because, they know the editor and this other thing. And when other people tried to rebut, then there was this huge kind of backlash or things like that. And there have been other things that have happened in the field. But again, when you are not taking seriously the lives and experiences of people who are experiencing these multiple intersecting oppressions, identities, they're not all intersecting identities are oppressing. So don't get me wrong there. But when you're experiencing those, those things, that's also something, the subtle ways you see discrimination happening. Does anybody want to dive in, spill the tea on their field? Nobody? Ooh.
I can go.
Okay. Oh, I'm just going to read Randy's thing and then go. Yeah. The tools we often use are not always accessible to people with disabilities, and few people take the time to think through how to make them accessible. SPSS. Okay. The P does not stand for party. And there are people who have said it is not accessible. There is a type of software that is accessible that someone's making, but it's not fully ready. Zoom chat. Thank you, Randy. That too can be an issue. But yeah, I'm sorry. Please go. Let me mute myself.
Wait, are you talking to me? Oh, okay. You're still muted though, but I know what you said. Yeah, I mean, so I'm actually not working currently, but then right now, I think I'm one of the only international students in my department. So it's just like when you ask questions, they're just like, oh, we don't know, you have to go figure that out yourself. because like I'm a nutrition student, so nutrition is mostly female and mostly white people or Caucasian people. So for me, it just like baffles me that how would you say we're a diverse school, but then you're actually not making provisions or at least learning what you need to what international students need to do in order to graduate, or what kind of classes I need to take to stay within status and stuff like that. And it just makes it seem like it's your responsibility, even though it is, but it's kind of yours too. So don't throw it on me. Yeah, so I just wanted to share.
Yeah, and I think that's a really good point that kind of leads me to like, we all have a role to play in, like, for instance, we have bystander training, we have all of these things, and we all do have a role to play when we see something wrong or something off. I've had issues in classes, or I've had conversations with classmates where I'll say, no, that's a little wrong, or it's happened to me. Yeah, so Randy said, not to say it's the same, but often with disability, it's the student's responsibility of the disabled person to figure out how to make things accessible for themselves. Someone said they don't see enough disabled faculty, even in SPH. Someone said I had a professor use an archaic diagnosis, the R word. Yeah, when discussing one of my research paper topics. Ooh, yeah, we don't use that word anymore at all. And so yeah, exactly. So the onus being only on the student rather than a collaborative onus of, okay, we all have to kind of figure out how this works. When you don't see diversity, or when you're in a field and the field's not diverse, there are a lot of people of color who do get nervous, like, okay, why is this area not so diverse, right? And then in non-diverse areas, some people will say things. And I have heard from other people of color in disability that, in the field overall, that there are issues we all need to address. And we're working on addressing them, but it's not easy. Okay, so next question is, in what ways do disability and race compound barriers? And I know we spoke about that. And in the last 10 minutes, I do want us to just like, yeah, there's definitely not enough staffing, processing times and stuff in the DRC. And you know what the thing is? Think about that, like funding, right? In terms of funding, how are these areas and aren't getting funding? The areas that are getting funded, it's not just the squeaky wheel that gets the grease, but that too. Who's getting funding, who is not. Yeah, normalizing elevator use. I'm definitely for normalizing not just checking elevators, but also automatic doors. I have found a lot of automatic doors don't work. And I will have to tell somebody, hey, this doesn't work. Or people turn them off. And even though you could turn them off, you can turn them off. And people will turn them off and they'll keep them off. Like no one will turn them back on. And it's like, okay, so how's someone supposed to get into the building? So that's a big thing too. But yeah, so disability, and we talked about disability and race compounding barriers. Do people, want to talk about instances of that? We don't necessarily have to, but again, it compounds it compounds access to care. That is one really big thing, right? If you are a person of color, depending on the neighborhood you live in because of redlining, segregation, what have you, there are not going to be adequate resources for the full life experience of African Americans, and that will include disability. That may include childbirthing services and child care services. So if you become disabled, now there's another inadequacy added to it. So now not only do I have to go further to go to a hospital rather than a clinic, now I have to go even further to go to a hospital or anywhere that is going to be able to help me with a disability or something that I have. So now that is more transportation that I can't compensate for walking. I can't compensate by getting a ride somewhere, paying a cab because I have to wait extra wait times or something like that. And this has happened to me. I don't know why. It's happened to me 3 or 4 times. I will wait for an Uber. The Uber driver will see me and then cancel my ride and drive off. So imagine having that happen as a Black disabled person. The ride is accessible because you had to pay 10, 15 extra dollars and you've had to wait 20, 30 minutes. They see that you're Black and drive off. So those kinds of things, think about, again, how that compounds the barriers. Rennie said there's sometimes cultural differences to how disability is approached, but often things are approached from a white professional perspective. Yes, that too. The way, and that's a really big thing when we look at disability and Indigenous people as well, or disability and African American people through the diaspora. The ideas about disability, very special, especially non-Western ideas about disability, are very much downplayed. And historically, we do need to look at the ways in which Indigenous or different groups of people handle or look at disability, to look at the range of experiences, because we don't want to center one type of experience, although unfortunately in literature or in the literature, right, we often do. So there was some, I was going to ask what barriers we haven't discussed. You can put those in the chat. But yeah, there are probably a bunch of barriers we've had, like sex ed. Oh my goodness, sexual education, huge barrier for a lot of disabled people. Getting inadequate sex education, or thinking, well, this person's not going to have sex, so we don't have to give them any sex education. That barrier too. And some people go to YouTube. There's different channels that kind of address that and talk about that. I think there's also podcasts too. I don't listen to a lot of podcasts, but I know there's probably a podcast for it. And then so in the last 7 minutes, I do just want to go with the final words. So one thing, because disability and race is so ubiquitous, is that we can examine many things through the lens of disability and race. And we should. We should examine health. We should examine wellness. We should examine opportunities and barriers, and the choices. I know Professor said, he's like, it's not that poor people don't have choices, it's that the choices they have are bad, or the choices they have are poor, right? And we should be looking at that. How are these choices? How do the choices people have? How are they created by the opportunities and barriers presented? What choices do they have to make to survive, and why? What kind of survival circuits do we see when it comes to, people of color who are disabled? Not just disability, but people of color who are disabled. How do we see circuits of survival, as they're called circuits of survival? How do we see this? Because doing so will allow us to better interact with populations and get to the root of their concerns, right? So the concerns of disabled people who live on the north side may not be the same as the concerns of people who live on the west side or on the south side, right? Because we may be dealing with very different populations, right? The concerns of disabled people in Little Village are not going to be the same as the concerns of disabled people in Ravenswood or in Lincoln, or like on the Gold Coast even, right? I'm assuming people live there. I I don't go there often, but I know people live there. I know. But we can do this work individually within ourselves, and I really think that's really important to always question and always think about how we are looking at things and the ways in which we see and think of them. And then also in organizations, the organizations we're in, let's think about, I was in a group and someone said something that was like a very ableist stereotype, and it didn't sit right with me. And I was like, how do I express this to them? Right. But I took a week, I thought about it, and then I let them know this was ableist and this is why. And we need to think about why we have these ideas about disability, why we are espousing these ideas, where do they come from? And are they just anecdotes that came out of nowhere that we're taking for fact, or what? Yeah, exactly. Normalizing those kinds of discussions is important. And I was very much in a space where I could do that, where I felt comfortable doing that. Making those spaces more comfortable. Recognizing we're part of society, right? We can't just say, oh, it's a societal problem. We are society. I don't know if you heard that. We are society. And as such, we can change society and health norms, right? In the fields we're in, we can look at societal and health norms and change them for the better. Right? And say, this is not normal to treat this group of people this way. This is not normal to have healthcare facilities so far away from the communities that need it the most. We need to, have these conversations. But the most important thing through all of this, all the things that I've been saying, we need to center disabled people and their needs, right? Because doing so will give them better quality care that is inclusive of their needs, their environment, and their capabilities, right? So you telling a disabled person that they need to eat better when they live in a food desert and they also live in a transportation desert, and and they're getting food delivered, right, is not helping, because it's just like, here's the problem. It's you fix it and you'll be better. That's not how that works, right? What you need to do is say, okay, what's going on? I see this, this, and this. What's going on socially, environmentally? How is your sphere of influence? You can think of Bronfenbrenner, right? Is that how you say his name? Bronfenbrenner. Um, how does your sphere of people influence what happens? What can you do? What can't you do? And what changes can we think about and work toward or work through to help with this? Right. And that might be offering more mental health services, which I think would be great. And I feel like that's what the city said they were going to do. But right, more mental health services, more, comprehensive hospitals, not just clinics or just small things, you know, and, listening, most importantly, listening to what disabled people need in those spaces. So those are kind of my final words. Thank you all. And if anyone has any questions, I know there were a couple, so you can just ask me, and then, or I can go back to whichever slide you'd like me to. Right? No. Oh. Oh yes, thank you. I'm really glad when I can present on the work that I do and the areas that I focused on, and we can also obviously when we get back from break talk about discussion questions. Yeah. Oh yeah, I love this work. So it is definitely a work of passion. So, and of course, obviously, if you have any questions, please email me, and I can answer or give referrals to any kind of further information that I spoke about that you want to know more about. So yeah.
Well, if we have no other questions, I will just thank everyone for coming tonight. And I want to invite you to our final session of the semester, in which we'll be talking about social change in practice. And we'll have Dr. Kamara Jones, who is a faculty member at the Morehouse School of Medicine, with us. So we're really excited to host her.
Nice.
And we're really looking forward to that. So we hope to see those of you who are visiting, hopefully next week for our final session. And so at this time, we will take a break for the students who are registered for the course, and we'll discuss our readings. And otherwise, if you're a visitor, we hope to see you next week for our final session. Thank you, Ms. Torres. Hello, everyone. Happy Thursday. Ms. Torres, I love your talk. I saw that we had a couple of questions on the discussion board. So I figured we could start with that. And then if other folks had questions based on the readings or based on the talk, feel free to put those in the chat and we'll be sure to get to those as well. Let's see. So we had a one question about bills on disability justice. Do you think the current bills that are up will one, pass, and two, be successful? You are muted.
I think one of the biggest kind of barriers is definitely not in the House, right? I think the biggest of barriers at right now is definitely the Senate, because the the House has been just passing things fairly relentlessly. And I think that's one of the biggest that's one of the biggest barriers. And I think that what's going to really matter, or what's been mattering more, which I have liked, is it's less about a Washington thing, but it is more about what's going on in constituents' home areas and home states. But I think if this doesn't pass, it's really, there's no one to blame except the people who are like stopgapping it, and people will always come up with excuses for why like very justice initiatives shouldn't pass, right? And I think that even there's bills that don't get bipartisan support that still pass. So that idea of the bipartisan support needed is not really the case. I feel like if there are justice initiatives that don't pass, then federally, then working with the states, right? Because I think that there's a lot of things that pass federally, and then when it trickles down to the states and the local municipalities, it means nothing, right? But what I would say is, even if you're looking for stuff federally, even though we are a centralized government, I definitely am much more of a local person, and that we should be doing local initiatives, local organizations, and mutual aid and stuff like that. And then the government just has to catch up, as it has been doing, right? Like, so many of us have been doing COVID relief before a stimulus, before there was even talk of a stimulus, right? Ever since, like for instance, ever since we had our first case in Chicago, a lot of disability groups I knew were ready for, like, once the first cases hit the US, they were like, okay, what are we going to do? How are we going to organize? How other disability orgs we know that we connect with internationally, how have they organized, right? How do we organize ourselves in a way that's going to work? A lot of them, like a lot of stuff, turned online, and online groups were just ablaze, right? And so I've been a part of so many groups, and they're like, okay, here's food resources. Here, this is open this time. Oh, does anyone need a delivery here? I can bring this here. You know, this is my capacity. This is my need. Oh, if I can't give you this, I can give you money. They were giving out grants for like $500 to $1,000. Again, before a stimulus hit, they were using fundraising platforms, Facebook, all types of networking things to make sure that vulnerable groups were seen and taken care of in a way that, you know, a lot of government federal agencies still have not done adequately. So, you know, for me, it's been it's really been like, yes, of course we need to push the government to do better. And I think the more kind of middle range justice initiatives will pass, right? But I think for the more kind of ones that are seen as more radical, it's always the streets, it's always the people, it's always the root, you know, the grassroots, and that's where I always go to. And I did a lot of stuff in government. I did a lot of student lobbying and stuff like that, and I've gotten, you know, $1 million+ initiatives to pass after years and years of working and pushing and pushing. But even then, we were also still making sure that locally it was things were being taken care of too. So it's not just waiting on them; it's also making things happen here when you can. You know, don't burn yourself out doing different things, but doing what you can when you can is better. Sorry.
Thank you. If anyone has any follow-up questions, feel free to drop those in the chat.
Mhm.
One of the other questions was, I'm wondering what actions are currently happening to address food insecurity for people who are disabled. So some of our articles suggested incorporating discussions on food insecurity during routine healthcare practices and access to education on financial literacy, household management skills, and coping mechanisms as possible interventions.
Mhm.
Is this happening?
Yeah, but that doesn't work if you're poor. How am I going to manage no money? Um, so my thoughts on that are, I've always been I always think that certain intervention methods are too individualized, and we actually talked about this in a nutrition class I was taking with Dr. Angela Odoms Young. Um, Having this onus strictly be on an individual doesn't, you can't manage money you don't have, right? You can't manage money when you're not even paycheck to paycheck, you're paycheck and credit card to paycheck. And so we can do those things without, I think that those things are good, right? I think that when people do get a little bit of money, saying, okay, well, you know, don't go to predatory tax people, right? Just file your taxes, just wait for them to come in, and then there you go, right? But there's also people who can't wait. You know, stuff happens, emergencies happen, as COVID has really been really doing a number on people. And so for me, it's not just about here is what you can do as an individual. It's also, like you said earlier, where are resources and how do we create more resources, right? Can we create more food pantries, food banks, mutual aid groups? So there are mutual aid groups that have been helping, like Love Fridge does definitely help. Social practice labs, I mentioned, they also help. There's a lot of mutual aid groups doing stuff all over the city, and once you find one, actually a lot of them are connected to each other. And this is a really great thing that when I was talking to Risa from Love Fridge before I had invited them to speak, um, she had said that it's not a competition. They're not competing with one another, right? They're working together. So, for instance, if one group is located in Ravens, I don't know why I keep mentioning that neighborhood. I just go there a lot. And another one is in the Ukrainian village. We're like, okay, well, this is our reach. We know something's happening in Ukrainian village. Let's connect to that group and say, hey, we know that, you know, one of our people's going over there. Do you have something that can help them with this? Or there's an issue when they live here. Can you help them with that? So once you get connected to like one group, and like I said, we had a couple people at Love Fridge, with a couple of different environmental groups. You can go to their Instagrams. If they have Facebook or Twitter, you can go to them and you can see who's following them and who they're following. And then it builds out and you can find those groups that are not just disability specific, but those who are delivering meals. Like I'm working with my program to deliver meals. There may be other people who are just giving people money. Like that's been happening too. When I can't bring food to people or I can't cook, or the person who was driving, she wasn't feeling well, we just gave them money, right? So that's another thing too to kind of look at. There's Top Box Foods, for instance, they do deliveries, they do home deliveries, and they take SNAP. 40 Acres Market, they also do food deliveries too. They also take SNAP. What's the other group that I've been recently? There's a co-op I'm with now. We're just starting though. So they haven't been doing, they're not doing the delivery stuff, but there's a lot of like, other organizations that are doing things like that. I'm trying to think. Yeah, and like I said, you just go to them or connect with the people that we've had speak here, and they can connect you to other places too. Someone said, do I know if any FEMA funds are being directed to those who have disabilities? I do not. I think the other issue is the reason I haven't heard about it in any of the groups I'm a part of, which is unfortunate. But yeah, and there are also, I know in Chicago they just released a story. Block Club Chicago, who I follow, they just released a story saying we have vaccines for everyone in Chicago. But like I think it was less than a week ago, a lot of disabled people were like, well, we can't get out of our houses. So what are you doing? Right. And like, for instance, Toledo, they're actually having the fire department go door to door to ask people, okay, did you get the vaccine? Do you want the vaccine? They're actually having people do that, like a system where, these, agents of the municipalities are going and asking residents, do they need help? Because they're trying to do the phone line thing. And sometimes the phone call thing have been working, especially for older people, but sometimes they haven't. There's no set specific time. So it's been random, or it's just, yeah, I know that they're starting the home visit vaccine program, but there are people who have just been like, they've been missed by that, or they don't have enough information, or they not, and part of that is, where are people getting vaccine information from? Because if you're just getting it from one source, that could be an issue, right? If you're just like every once in a while, I'll see something on Instagram, or every once in a while, or even if I signed up for the vaccine program, I know someone who signed up to get the vaccine program, to get the vaccine alerts. Every time he gets the alert, he clicks on it. He's like, I've gotten 5 alerts. And every time I go, they say, oh, there's no more vaccines when I try to sign up. So there's enough, but, so.
All right, we have another question. Someone was wondering if you could speak about the existence of a tension between disability justice and disability rights. So are fights for disability rights considered more accessible versus those on disability justice?
They're considered more palatable, for sure. So you do have the disability rights movement, and you do have the ADA, and you do have these things, but a lot of them don't go far enough. And it's interesting, there's this woman, rest her soul, Marta Russell, who actually talks about this. She's like, the idea of these rights, because the only punishment is you won't get government funding. Okay, well, if we're an agency that wasn't getting government funding anyway, what do we care? Or if we weren't getting many government grants, what do we, so there's not really much we'll give you a fine. Okay, we'll do the best we can. A fine is just permission to do something at a high price, right? So there are some places that, it's not just about a rights framework, right? Like you have a right to this. Well, I should have always had a right to this, right? But justice is about also correcting wrongs, right? Also about something greater than just acknowledging a wrong was done and saying, hey, let me put a Band-Aid on it. It's more like, how are we going to make sure this wrong is not perpetuated, and how do we correct, how do we make this right? Like, how do we make this just, right? How do we make this right? And how do we move forward? Like when we talk about environmental justice, it's not just about, okay, well, let's stop building these facilities. It's okay, what do we do about the facilities we built? What about the people that we have, the lives we've had ruined, right? Whether we're talking about disability, whether we're talking about lower job outcomes, whether we're talking about the people we displaced, things like that. How do we make it right? So I think that there's definitely a difference, and one is much harder to do than the other, right? Even though we have all of these disability justice things or disability rights things on the bill, like IDEA and free and appropriate education and the ADA and 504 or Section 504, the Rehabilitation Act, and all those things, how are they and how aren't they producing just outcomes for people with disabilities from a disabled person's perspective?
Thank you. Someone put in the chat, could you talk a little bit about when it comes to food delivery or generally helping, how can students take part in something like that?
Well, I know some places do offer, like Top Box, they do a lot of stuff is volunteer. So there's that. Or again, you can see if there's a food pantry in your area. If they have people who, like, I haven't seen this person in a while, maybe we should bring the food to their house. You can volunteer to drive, you can volunteer to pack food, talk to them about joining their organization. So that's something you can definitely do if you want to donate funds, or you want to drum up support for the food pantries for people to donate. If you can find a love fridge in your area, you can always, put some in it, or tell your family if they live in areas with love fridges, hey, when you go to the store, could you put something extra in this fridge? You can also start with your neighbors. Like, so those USDA boxes, we never got them in my neighborhood. Like, I'm on the west side, never got them. But a friend of mine was like, oh yeah, this woman had 8 extra boxes and she brought me 4. And I was like, okay, cool. I need 1 to cook for one of the families who needed extra food that week. But I knocked on my neighbor's doors like, you need this, you need this, you need this box of food. So that was something else. So if you can find those FDA boxes and people who might, or USDA boxes and people who might need those. So this is really an interesting paradox. So the question is there any worry about food delivery services such as Uber Eats becoming more predatory against disabled people or people who rely more on food delivery service? There have been quite a number of stories of, because of the leave it at your door policy that was happening, that was just mandatory across the board. They were just leaving people's food outside. And there were a lot of disabled people who were like, I can't carry this upstairs, right? So who's taking this upstairs? Like, I had a friend, they left 8 bags of food outside her building and just left, right? They took a picture, they sent it to her and left. She had to carry them one by one because she couldn't carry them all. She had to carry items little by little up to the elevator. I think she was on the 8th floor or something. Up the stairs, down the stairs, up the elevator, down the elevator, and hope nobody stole her stuff. Right? Because there are people, if I'm getting it delivered to my door, and as a disabled person, I'm going to need it there. And that was a problem with food delivery services beforehand. There are stories they didn't want to stop, like, come downstairs in the lobby. I can't come down to the lobby. I need you to come up here. So that's one big issue. And prices have been going up in terms of delivery, or a lot of people have not been able to get food delivered to their neighborhoods. I don't really know the logistics of, because if I lived in this area and there's a courier there, they just can't drive here or something. So there have been issues with that, but a lot of vendors have had issues too, because they're having an issue getting people in the restaurant because of COVID, right? Or having anybody there because of the restrictions. And then, the other side of that is like, these places have said, oh, we're going to charge less, and they don't. Or we're going to cut back on some of the charges, and they don't. So there have been more issues with that. And yeah, in terms of disabled people, their biggest issue is they're not getting the stuff delivered in a way that is accessible for them. Or substitutions. Oh, that is the biggest. When I order from Walmart, they always say, do you want substitutions? I always say no. If you don't have it, you just don't have it. But there's some people who have dietary restrictions, and the person who does the substitution, it won't even be the same. My friend was like, oh, we wanted ice cream, they gave us yogurt. Those aren't even in the same section of the store. Like, how do you? And then one time, I never do substitutions, but at one point I was in so much pain I couldn't go get cat food for my cats, so I had to get it delivered. I don't know what they brought. They brought me something that was a different size. It was a different price. It was like a $30 price difference. They gave me the cheaper thing, and they were like, oh, you said, I was like, I've never put a substitution. I don't do substitutions. They're like, could you just bring it back to the store for a return? If I could have brought it to the store, I would have went to the store and bought it. So that's another thing. People with disabilities who I can't go, and then you're giving me substitutions. Or there's another issue. We talk about equal and equitable access. These apps do not provide equal access. One, some of them are not accessible, but 2, You cannot buy the same things in the store as you could buy if you went there. So some things they'll say not available for curbside service, meaning they won't put it in someone's trunk to bring it to you. Then that means I'm not getting the same service as someone, right? And there are obviously some things like I can't get like the Subway sandwich in Walmart on your way out. But there are certain whole sections of food, whole just things that people just cannot get. It's not even showing up when you type. It either says it's out of stock, which it's not, or if restaurants do the same thing, they have a much more limited menu. And sometimes that's because, okay, maybe it'll spoil if it's being transported, or maybe it's better for something. But most of the time, the menu is significantly different. The prices are significantly higher, which, if we're talking about disability and poverty, that's not helping. So I'm having less options, I'm paying more, and I'm not even getting it delivered in a way that's accessible to me. So those are the ways in which disabled people have been having issues with um, these kind of app systems. So sorry, that was a lot, but yeah.
Yeah, that's a great question. Do folks have any more questions or comments on any of the readings, or just some thoughts you would like to share?
I guess just a comment to share. One thing that I really liked that you mentioned, Ms. Torres, in the talk was about how people with disabilities is like the disability is related to the environment and the way that we've structured up society, rather than something about like that individual. And it reminded me of, I read this article in undergrad about how maybe we should say enabled people instead of like able-bodied, because really it's not about that person's body that makes them able. It's the environment enables people, to get to the fourth floor because they have stairs and they're able to access those stairs, right? So it's like, I think that perspective of thinking about disability is really more about the way we've set up society, and the environment is really important in all of this. So I appreciate you for bringing that up.
Yeah, thank you. And I think that's a big thing for a lot of people, especially in other fields that aren't disability studies related, like thinking they're the same thing. And it's like, when you parse those out, I think it is kind of easier to reshape how you see things. Well, and we actually, in my DHD 101 class, we actually have students navigate through how would you get to school, right? And how would you get to school if you had, and it doesn't matter what kind of disability, but how would you get to school? Because you could have one disability, you could have multiple disabilities, you could have a different type of disability from another person and still have a barrier. So someone mentioned, well, the trains, if the trains don't talk, then how am I going to know what stop to get off at? Or if the elevator doesn't work, but they never told me an update, then how am I going to navigate that? Or I don't live near a train station, or I live near Metro, or I live, So that was the thing. And everybody forgot about the weather. Almost every student always forgets that weather is a huge barrier, especially where I live, where they weren't shoveling any snow. I could only get out to like my front like area where my stairs were. And that was it. I was like waist deep in snow because they had never shoveled anything near me. And the streets and the sidewalks were off. And I was like, no one's getting anywhere in this. So that was another thing too. Also, we think about the environment, think about how it changes, the weather and things like that. So, but I'm really glad I was able to kind of broaden perspectives and have people understand or think differently or add to their thinking, about how we can look about disability and race, both separately and together in health and social outcomes.
Yeah, I really love like talking about the built environment as well as the social environment, and how both of those converge together in creating these inequalities, drawing attention to that.
Mm-hmm.
Any other comments, questions?
So I remember there was I think the time that we came to like America, like the first year or something like that, and we tried to take the train. So as I was climbing the stairs, my mom was like, so since like this whole area is like you need to be able to like climb the stairs in order to like get to the platform to get to the train. How do people like with wheelchairs and stuff like that get there? Like, do they need to like move to like I pick like an Uber or something to get to like the next train stop, or like how does that work? And it was like I was really curious about that because sometimes on like the trains they have a map where they states that this is wheelchair accessible and then this is not wheelchair accessible. I'm like, but this is like public transport, so I feel like things like this should be included in in its planning.
Yeah, and some are what they call grandfathered in, meaning that they don't have to make updates because they were so old they were before like the ADA and things like that. But recently in New York, they were building a new station with no elevator, and people were suing like you can't, like you legally can't. And they were like, we're gonna, oh you can't, you think so? No, they shut all of that down, and they had to put the elevator, which costs more after the fact, but yeah, so someone I when I was at the train station, I was on the red line. I needed to get to well, I need to get to the red line. I was at the Roosevelt red line station, and the elevator just was not working. So I was there, and then there was some person who was in a wheelchair, and he was standing next to me, and I had like all this like stuff, and I was like, I can't carry this down the stairs. What am I gonna do? So what wound up happening is he's waiting, I'm waiting. The elevator, not mind you, didn't say it was broken, right? I checked before, and he wound up having to go to another station. Thankfully someone did help me carry the bags down the stairs and didn't like they did were like, oh here, let me help you. So I got help carrying the bags down the stairs, but otherwise, like what do you do? And that's what you have to do, and that's the problem. Now I have to find another station that may not even be the red line. Now I have to take to another line to connect to the red line somewhere else and hope that's accessible. And so planning a trip is much more difficult, and it's unnecessarily difficult, and sometimes those trip planner apps don't help because they don't always take into account disability, or they don't always have the updated like train or elevator status. So and it's just the worst.
Yeah, that was a great question. I know we're at time, and so if you have to go, you're free to hop off. I just want to add a friendly reminder. Kelsey put the link to our kind of release forum. If you would feel comfortable sharing some of excerpts from your reflections or your art for advocacy assignment, and even your final assignments as you're doing those, Kelsey's she sent the link out, and she put it in the chat. So feel free to complete that when you get a chance. Otherwise, we are really looking forward to seeing your final assignments. Yeah, I'm really excited. All of you are doing such great creative work. So feel free, the discussion board for that assignment is open, so you can post that when you have it ready. And feel free to check out what other students are doing. And remember, you have to comment on 5 other people's assignments. If you have any questions, we can hang on for a minute or 5, whatever it takes. Otherwise, I'll see you all next week.
Yep. Have a great weekend, y'all. Bye. It was great talking to you all.